everyone has mental health. That doesn't mean everyone has a mental illness. And I think the conversation around mental health needs to define what that is versus what mental illness is.
Welcome to the Pulaski Planner, where we share the stories and wisdom of the professionals who manage our public lands. I'm Catherine Kirchner, your guide to building a retirement as adventurous as your career. Let's get started. I want to welcome you today, and if you don't mind, give us like an introduction, and then if we could just start with how do you plan on, or probably since it's already May 22nd, but how do you celebrate Mental Health Month? Being May is Mental Health Month.
Absolutely. So, well, one, thank you for inviting me to be a part of the podcast and talk about mental health because it's very important to me. What I'll say is I actually do something for Mental Health Month. I make it a point that when, people routinely just say, "How are you doing?" During Mental Health Month, I double down on that question. And what I mean by that is if I ask somebody, "Hey, how's your day?" They're typically going to just be like, "Okay." What I do is I'll look around and I say, "No, like, how you really doing?" And then oftentimes I'll get a very different answer and they'll start to download. So particularly in the month of May, I kind of do that, but I try to do that, throughout the year. But May, I make it a point to do that. But to answer yourself, my name is Kalim Wigfall. I serve as the Chief Wellbeing Officer for the Forest Service. I've been with the Forest Service a little under 4 years. Prior to that, I served at the U.S. Department of Health and Human Services, where I was the Deputy Director for Behavioral Health Services. I served there for about 3.5 years. And then I served in the military. I did 20 years, and 13 years of that was in the Coast Guard. 7 was in the Navy. I was enlisted in the Navy, and that's how I, ended up getting into the healthcare profession. But since that time, I've always worked in like employee well-being and support and resiliency. My background is behavioral health. My doctorate is in behavioral health.
Nice. Appreciate that. So first of all, you look too young to have that long of a resume, but good on you. Must be doing some things right. And thank you for your service in the military. So how did you land on Chief Wellbeing Officer? Was that like a name that was already there, or how'd you get there?
Well, let's start with the military. When I was in the military, I was an officer, and what got me actually into working into the space was one of my collateral duties was what they call command drug and alcohol representative. And essentially that was a person who helps people navigate back to a wellness. So they may be struggling with substance abuse, mental health issues. And because I was previously enlisted, I just had a rapport with the enlisted crew. And so my collateral duty was helping individuals navigate, young sailors navigate who may be struggling with certain issues. But this one incident, there was a young man who had suicide-ideation. So they asked me to take him to the emergency room. And I actually took him to the emergency room. And that's kind of where I realized this is something that I want to do professionally. I just didn't know that organizations had this internal support structure where they help individuals navigate. And I wanted to do that. So I left what we call responder. So I was a law enforcement officer, a boarding officer in the Coast Guard. And then I pursued my master's degree in health administration. So I was just fascinated that organizations had this support structure. So I did that in the Coast Guard, and maybe about 3 years before I was going to retire, I started really focusing on what jobs existed, and I heard of a chief well-being officer. And it's typically jobs that's in corporate America. You don't really find them in the federal workspace.
Yeah.
So when I left the Department of Health and Human Services, when I came to the Forest Service, I kind of said, "Hey, I'm the chief well-being officer," and the name, caught hold. And one day the chief of the Forest Service referred to me as the chief well-being officer because that was the role I was essentially filling, and I've been named that title since, or carrying that title since that time.
Wow, that's awesome. So many different questions I want to follow up on there, but you kind of gave me an on-ramp for this one, so I'll go here. What does it successfully look like to sort of integrate that, approach? This is what initially caught my attention on LinkedIn was some of your posts about how you like try to make it lower the like friction or the difficulty that someone might have to like get into a pathway to help them with something that might be going on. So what does it look like to, shift from like checking a wellness box to like supporting people and, specifically, supporting people behind the badge with the Forest Service?
Well, I think the first part is understanding this is the space that I work in is, you have a lot of bureaucracy and you have a lot of red tape. And oftentimes particularly in the government, it's very black and white, right? It's policy based and we move in the structure. What I will say is in the space that I work, you have a lot more gray area because we're talking about the human impact. We're talking about people, right? And so you are able to navigate outside of that scope in the sense of checking the box is one thing, right? But what does that really mean? How does this show up? What is the end result? Are we connecting people to resources? Are suicide rates dropping? Are they increasing? Are they stagnant? And so what really caught my eye was that the numbers were continuing to rise, right? And yeah, we have these different services, but people are not connecting to them. And so I need to figure out why aren't they connecting with them? And oftentimes you hear people say, hey, I don't necessarily trust the EAP. It may not be confidential. So it's my job to educate those individuals, and it's definitely confidential service, and help me understand why you don't trust that. So I want to navigate that space. So it's really investigating and really getting to the bottom line, and that typically at the deck plate level where you find the truth and not what top management may think the truth is. And so I just approach it from a very humanistic standpoint, and I want to know why you're not pursuing certain things and how can I help you navigate that space.
Have you found some success in helping people understand the EAP program better and deciding to use it?
Yes, but it's still challenging, right? So I think one of the challenges is when you think about mental health, people often associate that with mental illness, and so I purposely frame mental health in the space of physical health. Like everybody has physical health. You're whatever, however healthy you are, you have physical health. Everyone has mental health. That doesn't mean everyone has a mental illness. And I think the conversation around mental health needs to define what that is versus what mental illness is. We're all on the spectrum when you talk about mental health, whether that's a loved one that tragically passed away, a bad day could change how you operate and navigate the world. And so that's impacting your mental health. Does it, if it prolongs or exasperates, that's when you get down the line to having a mental illness or a mental health issue. And so I really frame it up as we all on the mental health spectrum. So I've been some success in that. And it's really about education to answer your question.
Yeah, I think that makes a lot of sense. And I think that kind of helps like work away maybe some of the stigma people might have about like, oh, I don't need that. That's not for me. Like, that's not how we roll in my family or whatever. And just, but you talk about like physical health. A lot of people in the agency, they prioritize physical health, whether it's tied to their job or not, whether in the field or behind the desk, like a lot of people prioritize taking care of their body. And so just to kind of link that and be like, hey, this is just another part of that makes sense.
Absolutely.
That makes a lot of sense. Okay, well,
Yeah.
let's
I like
transition.
to say it's all
Okay.
in your head.
What?
I like to say it's all in our heads,
Yeah.
everything.
Yeah.
So
Right. Let's transition a little bit and talk about something that's like a little bit more in my lane as a financial planner who primarily works with professional land managers. Um, Financial stress, right? Do you see that as like sort of an out of the office stress that people are carrying into their lives in the agency, or is that you run into that much?
absolutely, but I think that it may show up very differently. Stress, the causative factor, whatever is making you stressful, like you're saying, could be financial, right? And so I know for a fact that we are not showing up and leaving those things at the door before we walk into the workplace. So whatever you're bringing it into your job, you're bringing it after work, you're bringing it to the bar or whatever you do to cope with your stress. It doesn't sit somewhere and just stay there. You're more 9 times out of 10 is showing up in the workplace. And I 100% think financial stress, particularly with the economy we're living in now, gas prices, all these other things happening contribute to that. I.e., just wanting to promote in a job is, to make more money is a reason to be in a state of stress if you're not making enough money to pay your bills. So yes, it definitely shows up. There's no distinction when you talk about what impacts your stress levels.
Are there ways that you think the agency is doing a good job or maybe could do more to support staff with that sort of stress of whatever nature that they're bringing into the workplace, whether it's financial or not?
Yeah, so speaking specifically to financial, um, oftentimes we think of the EAP program as really a counseling service, but it also is a work-life component to the EAP program. And a part of that is financial management and financial counseling, and tax preparation, all these other services. Again, when we talk about employee support, it's the gamut of these things. So yes, it's an opportunity for me to promote those programs, particularly around, financial management. And if you're struggling with that, you could call the EAP to get guidance around how to navigate and have better financial responsibility.
Do you know what the utilization rate is of some of this stuff?
So for EAP, the utilization rate is usually around 4 to 7%, depending on the organization, which is extremely low, right? But um, when people do engage with the EAP, what I've heard is they have good experiences. And unfortunately, those that have said, "Hey, I don't like EAP, or I'm not dealing with it," when I dig a little deeper, it's more of a rumor because they haven't actually called the EAP. It's somebody that may have had a bad experience, and then they take ownership as if that was their experience, and they've never actually engaged. So I would say it's an employee benefit that everybody should at least use to see what it is and know and have that firsthand experience rather than a secondhand experience.
For sure. I was gonna ask, do you know if there's like a queue or like a long wait time with some of that stuff that you're mentioning? Like say whether it's tax prep or the counseling with, work life balance stuff?
Also, so specifically for counseling, depending on the severity, so they will do an assessment, right? If it's a severe, you're gonna see a counselor immediately.
Hmm.
If it's urgent, 9 times out of 10 we're gonna refer you to an emergency room or call 911. But if it's something you can deal with, you typically can see a counselor within 4 to 7 days. Is the average wait time to set up an appointment.
Do you know about like tax prep stuff? So obviously that's seasonally, tax
Okay.
season, it must be more busy, but do you know if there's a queue or anything for that?
Yeah, you would contact the EAP at your organization, and for the Forest Service, it's Federal Occupational Health, and that would fall under the work life program, what employees have access to, and you connect them. They would connect you with a provider who does tech preparation. I'm not sure what the wait time it is, but it's fairly quickly. Typically, you try to do these things within 5 business days at a minimum.
Nice. Yeah, I work with folks who are thinking about retiring, and sometimes, like with the backlog with OPM and things, people get a little discouraged, like they kind of feel like tossing their hands up like, it's not gonna work out, or I don't have time for that. So I just if we can, spread the word about some of these things not being as backlogged as they might think, then maybe we can increase that utilization rate.
Yeah, one of the good things what the Forest Service has done is we use a hybrid model. So you can contact our internal resources, our internal support team with the employee support and well-being branch under the CARES model, and they can help you navigate that space and connect you with the resources that you may need.
That's great. Okay, so you have, a diverse background, haven't spent your whole career in the Forest Service, and so can you speak to, like, some of the differentiating qualities that working in the Forest Service like, we have people who have, like, desk jobs, but then we have people who have, like, jobs that involve, like, high amounts of inherent risk. Like, has that been, like, noticeably different from your previous, lines of work, or is that all kinda the same?
It's different. So of course they have the different nuances, but I come from a military background, and i.e. the Coast Guard is a responder agency, right? And so very much like the Forest Service, the Coast Guard dealt with the public. Often the military doesn't deal with the public; they deal, internationally. But the Coast Guard specifically dealt with the public. So there are some similarities and what that is, particularly when you talk about wildland firefighters and protecting communities. Um, but we also are responsible for non-responders in the Forest Service. So you have a mixed bag of what interventions, what approaches may be used to provide level of support. But there is, um, of course, a higher involvement or higher response for our responder community, particularly when you're talking about acute response or fires or critical injuries, fatalities. So you will see a lot of that focus on the responder community, but those things do happen for non-responders, and we provide the same level of service and support. So
Do you find that your work life has seasonality to it? That ebbs and flows with the people you serve?
for me personally, or just in work,
Both. Like I would imagine, like, do you see an uptick in like needs around wildfire season or
absolutely. Yeah. So during wildfire season, of course, there's a huge uptick, but it's we're year round, because when we're not, particularly if you're talking about the responder community, when we're not in fire season, we're doing training, right? And so we're doing education or psychoeducation around support system. We're doing hospital liaison training. So it's ongoing, it's continuously. So it's not like an off season per se. And then of course, mental health doesn't have a time when they check in. People are dealing with loss, loss of life of loved ones, and so it's not a there's not per se an off season, if that's the correct term. I'm not sure, but
I've heard from people who do the wildland fire stuff that sometimes it's the off season that's harder for them than obviously it's go go go, but that's what they've signed up for. It's usually the hard shift, the hard pivot from like winding down that is sometimes the hardest time to adjust. And so
yeah,
you
I
find
agree.
that.
Yeah, we're talking about, especially during the season, you're talking about hypervigilance. You're out, you're with your teams, your hot shot crews, you're really out there, putting in the work. And if there was a fatality or unfortunate situation when you are in the off season, now you're sitting with your thoughts, and you're reliving these experiences, and you're downloading, and it can be very difficult. And that's why we definitely, particularly I know in the Northwest, particularly in the winter months, right? There's definitely seasonal depression and these other impacts to one's wellness. So we're mindful of that. And to my point, there's really not a off season because it's continuous.
Right. You want to make a pitch for vitamin D? I'm a big fan of vitamin D.
Well, I'm actually in Florida, so I'm a
Uh,
big proponent of vitamin D as
I'm in
well.
Montana, so we definitely have to pay attention to, the long season of winter, even if we're not getting the snow, which has been the case this past winter, but like that seasonality that you're talking about, like with being alone with your thoughts and being inside and stuff. So we try to get the vitamin D sunshine whenever we can, but it's a little different from
Point,
Florida.
we are accessible, particularly if you're talking about the EAP program, 24/7, 365. And then even with our hybrid model, you can reach out anytime as well during normal business hours. But we're going to connect, you know, 365. If you're in need of support or help, we're going to be there to answer the phone.
Absolutely. Well, that's good. Hey, I'll make sure to include those numbers and stuff like in our episode notes and such, so people can easily, if they think it's something and they think about it, we want to make it easy for them to find. Um, Last question I like to wrap up with is what is one tool that you couldn't do your job without? And so with this question, you can be like super literal, or you can be more like figurative, but you can take it however you want.
One tool that I couldn't do my job without?
Yep.
That's a great question. I would say I'm a proponent of taking leave. Right. And so I know there's in the mental health space, there's a conversation about there's no such thing as work-life balance. There, but I do believe you have to recharge, right? So you can show up a certain way. Um, so the tool that I would use is self-care. How do you care for yourself? And I'm not sure what that looks like for other individuals, but everyone has a personal self-care model, whether that's, enjoying music, getting in a car, going on a joyride, a trip, going to the beach. So that's the probably the most prominent tool in my toolkit is ensuring that I take advantage of my self-care and show up a certain way because of that.
Absolutely. That's a good one. Yeah. Appreciate that. Yeah. Self-care can look a lot of different ways. Depending on your like life and stage, like I have 4 kids and some of them are really young. And so like sometimes self-care is just like going to the grocery store by yourself. Like
Yeah.
that can be, it's like so doable if like you lower the bar. It doesn't have to be some like spa day or something. So I
It could be a
resonate.
walk. Like I walk, and I don't, in the last 2 weeks, I've been walking 4 to 5 miles every day, but I live close to the beach. And so that's been amazing for me. So yes, I agree. Absolutely.
Well, awesome. Well, thank you so much for your time. I'm looking forward to sharing this episode with everyone. We got it in before the end of May. I was kind of late on the game about Mental Health Month, but I'm glad we got this on the calendar.
No, thank you for the invite. I appreciate that. I really appreciate the work that you're doing to really promote, particularly during Mental Health Month, to promote this because it is important, and we have people that are struggling. So
Absolutely.
it's amazing that you're doing this and being a leading voice in that, particularly for the Forest Service and the work that particularly the wildland firefighters are doing. So thank you.
Yeah, those are my people. Yeah, I just have a heart for what they do. My husband was he worked for the Forest Service for a while. He transitioned out of that and he's in education now. He's a university teacher, but that was kind of our lifestyle when we met, and those are just sort of my people. So anything I can do to help the community.
Awesome. Well, anything I can do to support, please don't hesitate to let me know and reach out. And again, thank you.
Yeah, appreciate your work, sir. You have a good one.
All right, you too.